Hi, I'm Dr. Kim Duramo, and I wanted to share in this video a useful mind-body healing tool to assist you if you are infected with the COVID-19 virus and you're experiencing symptoms. I'm an emergency medicine doctor who's now sharing mind-body medicine for self-healing, how to activate the body's healing response as part of what you're doing to assist your body in getting better. This is not a substitute for direct medical care or medication, but I wanted to create this video after so many requests for EFT. How can we use some mind-body tools and EFT specifically for people who have COVID-19 or viral symptoms and where, we want to support the body's healing mechanism. There was an Australian patient in Japan who recently shared a really beautiful video that he had used EFT Meridian Tapping, was about to get on the ventilator, had really severe respiratory symptoms. They wanted to put him on a ventilator, and he wanted to try this instead before, going in that direction. And he actually recovered very, very quickly after using EFT tapping, did not need to go on a ventilator, and had a much shorter than expected course. So for that reason, so many people have wanted to have a video of what did he do? How do we use EFT tapping to support the body through COVID-19. And, being a physician, I've used EFT tapping many, many times in the emergency room and actually seen really incredible things because the patient's sitting there on a monitor really quickly. Heart rate coming down, blood pressure improving, respiratory rate and oxygen improving. This is not acutely right now during COVID-19, but in the past in my career as an ER doctor, for patients with all kinds of different illnesses or anxieties, and other emotional symptoms with really profound results. There's also an extensive body of medical research done to look at how EFT tapping is affecting your brain, is affecting your body, your physiology, and assisting healing. So you can certainly do some research to get more information about that. I'm going to go into the tapping, the actual exercise now for the purpose of this video, and know that you can make this more specific to what's coming up for you. I'm going to go into some of the general symptoms people are having when they're experiencing COVID-19 and resolving and neutralizing some of the underlying emotions, which are what keep that inflammatory pattern, that contraction in place when we're experiencing symptoms, especially when we can't breathe. So it'll be a mix of all of the above. When you begin, and we're going to start now, just take a few deep breaths and feel your body. What are you feeling? What are you noticing physically, mentally, and emotionally? These have been shown to all be tied together in creating the chemistry, hormone shifts, the inflammation that goes on in the body with illness. So you can write some of these down and pause the video right now, or I will be using some general terms that will assist you as we do the tapping together. But just gauge for yourself on a scale of 1 to 10 how severe your symptoms are now, physically, mentally, and emotionally. How intense is what you're experiencing right now? Because you're going to see that number change as we do the tapping. Okay, so receive a few deep breaths, have the awareness of your number, and bring your attention into your body. What are you feeling here? Especially when we have illness, we just want to escape and we bring our attention away from our body. We actually disconnect. That is not what we're going to do during this exercise. So as best you can, receive a few deep breaths and relax your shoulders. We're going to start on the first meridian point, which is the karate chop point. On the outer edge of your hand, the pinky edge of your hand, one side, both sides, you can tap them both together. It doesn't matter. Pick a side, gently, gently tapping. And I'll have you repeat after me as we begin, and then we'll move into the regular meridian points. So we begin here on the karate chop point, and you're gonna just repeat out loud, even though these symptoms are so severe. And I'm afraid of what's going on in my body. I choose to love and embrace myself fully. So just tapping and repeating after me. Now we're going to do 2 more rounds just like that, even though this is so intense and overwhelming. I choose to embrace this experience and come into peace. Okay, 1 more. Even though this is overwhelming and I'm afraid for my life. I choose to be at peace now. Good, so just gently breathing, repeating after me. You're just giving new information to your brain. Inner eye point, it's right on this bony ridge. You can tap 1, you can tap both. Either way is fine. Breathing in, breathing out. All of these symptoms I'm having. Outer eye, I can't breathe. I'm coughing. Under the eye, it's overwhelming in my body. And if tapping is too much, just lay down with your hand on your heart and receive my words. Under the nose, feeling fever and chills. On the chin, feeling my body succumb. Under the collarbone, so much discomfort. Under the arm, and I'm so scared. On top of the head, I don't know how to fight the virus. Inner eye, I'm afraid if I succumb, I'll die. Outer eye, noticing this coughing and problems breathing. Under the eye, I can't even breathe. Being willing to feel the depth of what you're feeling. Under the nose, noticing all that I'm feeling in my body now. On the chin, the speeding up with fear. Under the collarbone, fever and chills. Under the arm, things getting worse and worse. Just noticing. It's okay to neutralize these things as you tap. And top of the head, being in a dark place with how bad this has been. Inner eye, so much discomfort in my body. Relaxing as best you can. Outer eye, I don't want to experience this. Under the eye, why is this happening to me? Under the nose, all the ways this feels unfair and oppressive. On the chin, it's not my fault. Why did this happen to me? Beautiful, just keep breathing. It's okay to let everything come up. Under the collarbone, feeling like a victim. Under the arm, feeling powerless. On top of the head, visiting these dark, dark spaces of despair. Good, just breathe through, bring breath to your awareness. Inner eye, all of the symptoms I'm having. I'm gonna do a little bit more. Outer eye, what would it take for me to relax into this as best I can? Under the eye, to embrace compassion for myself. under the nose, for how horrifying this experience really is. On the chin, in a way maybe no one can really understand. Under the collarbone, in a way I can't even bring myself to fight. Under the arm, really feeling this powerlessness and despair. On top of the head, it's okay for me to acknowledge what I'm really feeling. And to let my body receive. Breathing in and just relaxing for a minute, breathing out. We did several rounds there. Noticing your body now and what your number is from a scale of 1 to 10. If you started off really, really severe, feeling severe symptoms, feeling severe fear, maybe you're at a 10, maybe you were at an 8. If you were at a 10 at that point, where are you now? Have you come down? Has it resolved? Has it gone up or intensified? Sometimes when we become aware and we let ourselves really experience what we're experiencing, it can amplify things. That's because the energy is moving. Bring your presence to your body and write the number down, whatever that number was, and just appreciate that. We're gonna just do a little bit more to begin to open you up to new possibility. So inner eye, what would it take for me to be present to my body now? Just breathing fluidly, relax your body as best you can. Outer eye, with all the fear that's really here. Under the eye. And bring a space of compassion for myself. Under the nose, meeting my body, not abandoning myself. On the chin, really witnessing how challenging this is for me. Under the collarbone, not being able to breathe, not feeling comfortable in my body. Under the arm, what would it take to embrace this darkness so I can come in to more light? On top of the head, to allow a release of resistance. Inner eye, to bring myself, my presence. Outer eye, and let all of this clear out. Under the eye, so I can relax and be at ease. Under the nose, even through this deep experience. On the chin, what would it take for me to open and receive? Under the collarbone, it doesn't have to come from me. It can come through me. Under the arm, accessing my power to heal. On top of the head, releasing trying, releasing responsibility. I can open and receive what my body needs. Okay, big breath in. Just put your hand on your heart and take a few breaths. Even if you're not able to take deep breaths, just relaxing your body. Realizing self-healing is not about you trying or you fighting. It's about you allowing and opening. To allow that opening to receive the healing that's available to you, your body's ability to heal. To allow that opening, simply coming into presencing your body, feeling and witnessing. You can do this as you tap. You can do this with your hand on your heart. realigns the electromagnetics of your body and allows your body to receive. So do the best you can with this. If you want to go deeper and do some more rounds, or look at what, if you want to write down what the symptoms are that you're feeling, write down what you notice and tap more specifically on what's going on for you physically and what you're feeling, the symptoms, mentally with ideas and thoughts of what may happen, or what about other people, what will they do if I get sick, or all the things you feel responsible for, and emotionally, the fear, the darkness, the powerlessness. It's okay to feel these things and witness them. It's not going to have a negative effect on your body. It's exactly the opposite. It's when we repress them, we try to overcome them, we try to escape and get beyond them, that all these energies get stuck in the body. So do your best to breathe through this time, and it's with deep, deep compassion that I send you my love as a physician and as a human being. I'm sorry that you're having to experience this and any of the things that go along with it. If you'd like to do a little bit more tapping, just gently sending I love you to your body. We'll do a round with this right now. Feeling your heart, feeling your body, feeling where there's pain, and just saying out loud with me, I love you, to your body. Outer eye, it's okay you're experiencing this. Tell your body is registering your fear thoughts. Outer eye, body, you can open and receive. Under the nose, body, it's okay to embrace this experience. On the chin, it's okay to move through this. Under the collarbone, it's okay for me to receive from others. Under the arm, it's okay for me to receive all I need to heal. And top of the head, it's okay for me to move forward in this new way of being open and receptive to life. Good, breathing in. And just let everything go. That last piece was really helpful. I hope that this has opened a space for you to deepen in your connection with your body. I can be found at drkimd.com if you'd like more assistance with understanding how to activate your body's healing mechanism as part of your journey and whatever you're experiencing, if it's illness, if it's fear with what's coming up, or just being in the unknown. I am live each week on Wednesday with a Mind Body TV broadcast at 11 a.m. Mountain in Facebook in the Mind Body community. We do also post this on YouTube, so you can access it there as well. Sending you so much love and compassion, and I hope that you are able to open to these parts of yourself and live in a much deeper way from this moment on. Lots of love from me.